I'm Pamela D. Wilson, your host for this webinar. We're going to talk more about bathing and skincare and incontinence in these parts. Bathing, believe it or not, can be a little bit of a struggle with elderly parents who refuse or who might be embarrassed to have you help them. So in this part, we're going to talk about what to do when elderly parents hesitate to bathe. And we're going to talk again, a little bit of a review about safety equipment for the bathroom, ways that you can talk to parents and become more comfortable yourself about helping them bathe and help them reduce their embarrassment. Let's get started with housekeeping as we always do. I use the term elderly parent or elderly parents for the person for whom you provide care. The outline for this module is in the course materials. You can print the slide handouts out. The ellipses, those dots on the slides, are purposely there for you to fill in the information and follow along. Let's talk about the objectives for bathing, skincare, and incontinence. At the end of bathing, skincare, and incontinence, you should be able to relate the different aspects of hands-on personal care that you might perform as a caregiver. You should be able to identify steps to make personal care less embarrassing for you and your elderly parent and more physically comfortable, and also gain awareness of skin or other infections that require attention and treatment. In this part, we're going to specifically talk about what to do when elderly parents hesitate to bathe. At the end of this part, you should be able to relate how fear of falling, physical discomfort, and memory loss can result in parents refusing to bathe, and also go back and revisit ideas and assistive devices to make bathing more safe and more comfortable. And we'll start with that. Simple steps can be taken to ensure that bathroom safety increases and reduce the likelihood of unexpected falls. Taking a bath or a shower can become difficult for an elderly parent when mobility issues, pain from standing, bending over, trying to lift a leg over that tub railing or a shower entry point is difficult. If your parent is physically weak, they have poor gait, balance concerns, arthritis, a number of issues. When your parent has already experienced a little slip or a fall in the bathroom, in a tub or a shower, they become more worried about bathing. While an elderly person may really resist the idea of installing any type of equipment in the bathroom, their reason is because they think, wow, somebody else is going to come and use this bathroom and they're going to see that I need help. So it's a dignity issue. If there are multiple bathrooms in the home, obviously you want to put the equipment in the bathroom that's closest to the bedroom that they'll use so that the main bathroom doesn't necessarily have to have this equipment, although it can. It's important to talk to your elderly parents about safety and risks. Installing the equipment will allow you to worry less. It'll give you peace of mind that your elderly parent is less likely to fall. It's also beneficial to caregivers who help elderly parents bathe. So, for example, when you use a handheld shower device and your parent is sitting on a shower or a bath chair, that gives you more stability to spray water on them. You're not actually in the tub or the shower with them. You have less likelihood of getting wet. And a parent who stands up in the shower or the tub, they can easily fall off balance and they can rely on you to catch them or stop them or prevent them from falling. Don't wait to bring up this subject of bathroom safety equipment. You might be preventing a fall for an elderly parent and preventing an injury for yourself that can have pretty serious consequences. Let's talk a little more about bathroom safety equipment and protective measures. I want to begin with the subject of using gloves. This has come up a lot in the discussion of the coronavirus. Healthcare workers use gloves for so many aspects of care. Family members should also use gloves for all personal care tasks with elderly parents. You might feel a little strange about doing this because you think, well, I'm just caring for my parent. How big of a concern could this be? Wearing gloves actually protects you and your elderly parent. Let's say that you have a cut on your skin. You don't want any type of bacteria or anything that your parent has to get on your hand. You also don't want that open cut to affect your parent. My suggestion is to buy several boxes of gloves, place them in every bedroom, every bathroom, in the kitchen area, keep a box in your car, and I'll share a story about that. When I would take my clients to doctor appointments or transport them, taking Flo to the golf course, I always had a box of preventative equipment in the back of my car. And the box would include a trash bag, gloves, wipes, Depends, a towel, and just an extra t-shirt or a pair of pants that I thought almost anybody could fit into. So one day my husband is looking in the back of my car and he's like, "What is this box for?" And I said, as I would with him, I'm like, "Do you really want me to tell you?" And he's like, maybe, maybe not. Tell me. That box that I put in my car, and I suggest that you do this too, was for unexpected accidents. You never know when you're going to have your parent in your car and they may vomit. They may have an incontinence accident on your car seat. You may take them to a doctor appointment and they may have an accident there. That little box back there, I cannot tell you how many times it saved the day when something unexpected happened with my elderly parents. So as a practical matter, if your parent has any of these issues, put that little box in the back of your car, leave it there. Trust me, it will come in handy for you someday. Let's talk a little bit more about bathroom safety equipment. You want to start with a handheld shower attachment. Your parents also can use a shower chair that goes in the tub. There are also different types of transfer slide chairs. So if they have difficulty getting in and out of the shower, part of that chair extends outside of the bathtub. They sit on it and it slides over into the tub. The benefit of that handheld shower attachment, you won't spray water into mom or dad's face. You will not get yourself all wet. And while we always get a little bit of wet when we're helping an elderly parent bathe, that handheld shower will minimize that water spray. For people who can still stand, your elderly parent can still stand and bathe, they can take that handheld shower attachment and just rinse areas of their body. Makes it easier. Grab bars can be placed in a variety of locations throughout the bathroom. Really, any area where a parent needs extra support to stand or to balance is a good location for a grab bar. Just make sure that when you install it, you're putting it into a place where there are studs in the wall so that the grab bar doesn't come out of the wall. Grab bars allow your elderly parents physical support instead of having to hold on to a caregiver. A lot of elderly parents will try to hold on to towel racks. Those come out of the wall. They're not grab bars. Raised toilet seats also make sitting down and standing from the toilet easier, especially for elderly parents with knee, back, or balance problems. A lot of raised toilet seats have arms that provide a push-off point for standing and for balance. That raised toilet seat for you as the caregiver and for your parent, it makes it easier to apply lotion, to sit on that and dress after they bathe. Shower chairs also offer physical support and stability. For a lot of reasons, you can even take out that shower chair and use it to dress on. But the shower chair, it provides physical support. It doesn't reduce that slippery tub or shower surface. So if you are putting a shower chair into a shower or a bathtub, make sure you put a non-slip shower or bath mat underneath that chair, in front of that chair, so that the chair doesn't slip and your parent doesn't slip. Let's talk about embarrassment, because this is a huge subject. Elderly parents may refuse or they may limit bathing because if they have physical pain or discomfort. And discomfort comes from a shower or a bath area that's cold. So many of my clients had one little heating vent in their bathroom, and during the winter it would get pretty cold. So we would take some precautions to warm it up. So tips to make a bath or shower more comfortable. You can use a space heater, but you definitely have to be careful to avoid contact with water. We would take towels and the bathrobe and we would heat it in a clothes dryer before we gave a person a bath, so that they at least were a little warm or room temperature when we used them. Other concerns: if the bathing area is upstairs or downstairs, and your parent has difficulty walking up and down those steps, remember, go back to the idea of double railings, railing on the right and railing on the left. If that really does become too difficult, there are creative ways to still accomplish a bath or a shower. You can do towel baths, bed baths. You can bathe a parent while sitting on a shower chair inside a little shower tub. I'll explain more about that in a minute. There are rinse-free shower caps and rinse-free soaps that you can use. You obviously don't want to use those all the time. So there are blow-up shower basins to take a shower in and also wash hair. So if you remember when you were little, remember the blow-up swimming pools that your parents got for the backyard, and they filled them up with water, and they were maybe, 18 inches high? They have similar devices for showering in the home. And if you are a camper and you've ever used a sun shower, the same idea applies to showering in the home. You can use a sun shower type bag and hang it above that inflatable basin. And you can put the basin underneath your parent's head to give them a shampoo, or you can put it on the floor and put a shower chair inside of there. So like when we talked about using tracking poles as an alternative to a walker or a cane, you can really be creative to work around these daily care complications about bathing. The other thing is to remember that your elderly parents might be embarrassed about you seeing them naked, let's face it, or you might be embarrassed about seeing your parents naked. This happens more when adult children are helping an opposite sex parent, so son helping mother, daughter helping father. I helped my father shower. He was so embarrassed. But I told him what he didn't realize by that time was I had helped hundreds of men shower. It wasn't a big deal for me to see that, but he was still embarrassed. You want to be able to protect the dignity of your parent. So I suggest using a small towel or a washcloth. If they're sitting on a shower chair, you can place that over their private parts or have them hold it there while you're bathing the other body parts. And then when you get to those parts, do them quickly, and then they can put that back on. You can also use a cloth bathrobe after they shower as part of a mechanism to help them dry off to protect their dignity, because that is a big issue with older parents. The first time you do it, you probably will be very embarrassed. I remember the first time I bathed someone. But if you don't show it, your parents don't know it, and then they become more comfortable with the routine. So it really is, if you show less embarrassment, your parent will be more comfortable. Let's talk about the importance of creating a bath routine. So using distractions like music and conversations about hobbies and other subjects can ease the embarrassment that your parents feel when you are bathing them. Creating a routine is important so that your elderly parent knows what that routine is. For example, you set out the towels, have skin lotion, shampoo, toothbrush, toothpaste, clothing, all set out before that shower or bath. And for women, washing their hair and putting a little bit of makeup on, it's an extra touch to the bathing process that just makes them feel a little bit better. Your elderly parent, unless there are concerns with dementia that we'll talk about in a minute, really may find that they appreciate the assistance that you're giving them. They feel better after a shower. Feeling fresh and wearing clean clothes really is a mood booster. Do talk to your parents and ask if you're doing okay throughout the process, especially if you are new at this. You want to focus on their comfort and involve them. If you are at all uncomfortable with the idea of how to bathe an elderly parent and your parent has mobility concerns, there's a couple of other options. You can make a doctor appointment and ask the physician for a physical and occupational therapy order. Health insurance will pay for professionals to come to the home to show you how to properly bathe your parent. They can also at that time make suggestions for bathroom equipment, show you how to do this safely, show your elderly parent how they can help you bathe them safely. And then another aside, you can also hire a private caregiver to come in the home to do a bath 1 day a week, 3 days a week. When I had my in-home caregiving business, Bathing was a project that we frequently were hired to perform because husbands didn't want to do that for their wives. Wives didn't want to do that for their husbands. The family caregivers were afraid of getting hurt or hurting their elderly parent. So if you're uncomfortable, there are other options. If you are comfortable, perfect. Give it a try. Let's talk about memory loss and bathing, because this really can be, I laugh, but there is many articles, many subjects about there saying that bathing is a battle. Elderly parents and loved ones who are diagnosed with dementia or Alzheimer's can present a greater bathing challenge. They have more fear of falling, more fear of water. They are more uncertain. For these people especially, a regular routine with days and times for bathing is very practical. For people with dementia, a consistent bathing routine provides comfort. They know what to expect. They have a sense of stability. You can put bathing days on a calendar. That can be helpful to avoid surprises. If mom or dad can still understand the use of a calendar, they can say, okay, there's Monday. I guess Monday is bath day. So is Wednesday. So is Friday. As with your elderly parents who don't have dementia, you want to be prepared with all of the supplies. You want to, especially for people with dementia, get through it as quickly as possible because they may lose patience with you. Communication in dementia is extremely important, as we talk more about in the module on dementia. Rather than asking mom or dad if they want to shower, which will likely result in no, or I already took a shower, what are you talking about? Do you think I'm dirty? I don't need a shower. No. Resistance. Here's what you say. You say, Mom, it's Wednesday. It's shower day. See on your calendar? Come on with me. Let's get ready. Let's go do it. That allows your elderly parent to realize that it's a regular routine. You're not making a big deal out of it. Sometimes you can have them help you pick out clothing and set aside lotion and toiletries. Other times, the point of dementia will get past that and you will want to get it done, get the bathing done as quickly as possible. There will be cases of severe resistance sometimes. That's when you can use a towel or a bed bath. You can try to wash body parts every day. So Monday might be leg day, Tuesday might be arm day. If you really can't get them in for a full bath or a shower, these are times when you have to be creative because bathing can become extremely difficult and they can be resistive, but don't give up. Attempt a bath in the morning. If they say no, try it again at 3 o'clock. They won't remember that you tried it. Keep trying different options. We're also going to talk about paying attention to the skin to monitor skin tears, bruises, and wounds, and the importance of pericare, which is probably going to be another difficult subject, but very important subject for parents who have any type of incontinence or toileting issues. So let's talk about a summary. Assistance with bathing or showering for elderly parents. It supports good hygiene, safety, and positive self-esteem. It is definitely a learned skill for caregivers. Again, if you've never done it before, see if you have a family member who's done it and might be willing to help you. You can also ask your doctor for that physical and occupational therapy order to have someone show you how to do it. Gaining confidence in bathing is something that really you can do. And at some point, these are things that we will all help our elderly parents with as their health needs progress. You can do it. You can be confident doing it, and your parent will feel good for it about the experience of bathing and feeling and looking good. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. Thank you so much for joining me in this webinar. Next, we're going to continue with more about bathing. I'll see you in the next webinar.